Optimal amounts of hyaluronic acid are crucial for healthy joints. Hyaluronic acid is a type of glycoaminoglycan, also referred to as a GAG. GAGs are complex carbohydrates that are bonded to nitrogen molecules. This interaction confers very special chemical properties on these types of molecules. Specifically, they have a very high negative charge. Now, the negative charge attracts water, and this confers unique physical properties on the water-GAG interaction. Specifically, these molecules can act both as shock absorbers, as they do in the cartilage extracellular matrix, and also as a lubricant, as hyaluronic acid does within the joint. As we age, the quality and quantity of hyaluronic acid diminishes. So it's essential that we optimize the amounts that we are providing to our joint to give us the best shot of having a healthy joint. What are the potential musculoskeletal health benefits of hyaluronic acid? Hyaluronic acid potentially boosts cartilage health. Some research suggests that hyaluronic acid boosts cartilage health, specifically by direct stimulation of cartilage cell proliferation and reduction in cartilage cell death, something called apoptosis. Research indicates hyaluronic acid may induce the synthesis of new GAG and proteoglycan molecules. As noted previously, as we age, the concentration and quality of GAGs and proteoglycans diminish. So it's important that we're driving the new synthesis of these molecules because they play such a role, an important role, a vital role in providing the shock absorbing properties for cartilage cells. Hyaluronic acid demonstrates anti-inflammatory properties. Laboratory studies have shown that hyaluronic acid decreases the activity and synthesis of something called interleukin-1 beta, which is a master signaling model that ramps up and amplifies inflammation. And it's also been shown to decrease the production of prostaglandin E2, which causes symptoms of pain and swelling, and also reduces the synthesis of something called nitric oxide, which is a messenger molecule that magnifies inflammation in areas of injury. Hyaluronic boosts the mechanical properties of the joint. As noted previously, hyaluronic acid is required for the lubrication within the joint, something called synovial fluid. Now, studies have shown in the absence of synovial fluid, you have a dramatic increase in the friction between the joint-bearing surfaces. In fact, some literature suggests that the addition of optimal amounts of hyaluronic acid decrease the friction load by 50%. Hyaluronic acid supports subchondral bone health. Recall that subchondral bone is the layer of bone right underneath the cartilage, and it plays an important role in the amount of stress that cartilage feels every time you take a step or you stand, or really there's any type of load on the cartilage. If the subchondral bone is too strong or too weak, cartilage cells are injured. Hyaluronic acid helps promote the ideal amount of subchondral bone density, so subchondral bone's not too hard or too soft, just the right amount to promote healthy cartilage cells. Hyaluronic acid is generally well tolerated. However, there have been known reactions. So, like any type of supplementation, don't consider supplementation before discussing with a qualified health professional familiar with your unique medical history.